Joining us now is Dr. Robert Murphy, and professor of infectious diseases at Northwestern University's Feinberg School of Medicine. Good morning.
Good morning.
Well, you got the vaccine yesterday. How'd it go?
Yes, I did. I didn't feel a thing, and I've had absolutely no symptoms. None. I'm surprised.
Well, I'm sure that's good news for a lot of people out there.
We have video here
of you getting it. Yep, you muscled through that well.
Yeah,
well done.
I got right through it. It's a very, very small needle. I didn't even feel it, and I haven't had one symptom. I'm really kind of surprised. I mean, the flu shot, I had more symptoms from the flu shot.
Well, that's good news. Let's move on to some other news of the day. You know, people keep asking about this new strain of the virus in the UK. Sarah had a good question. How do you know if you have that new strain? And is it, I mean, you would think everyone is just getting a COVID test. How do they know that this is a new strain, and how do you know you have it?
Well, you have to do genetic sequencing, which is not done normally in a lab. It's a very sophisticated laboratory test that has to be done with it. They noticed this in the UK because the numbers started just jumping astronomically. And they have a really good genetic surveillance system in the United Kingdom, really excellent. And they went in and tested it, and they found, oh my God, they got this new strain. Well, they had already seen that new strain in Denmark with the minks. Remember the mink story?
Oh.
They also have a new strain down in South Africa, which might even be worse than this one in the UK. So it's very disturbing because not only does it, we know that it spreads faster, that's for sure, but is it actually make worse disease? That actually we don't know. We can't answer the question. And then the big question is, will the vaccines work against this new strain? You know, we think so. You know, it's being studied. But the answer is not clear yet.
What about chances that that strain of the virus is already here in the U.S.?
Well, I think the chances are good. You know, we have flights in and out of the UK every day, and that's how this thing spreads around. We did not close the border with the United Kingdom. Ireland closed the border, and they bordered Northern Ireland. France shut it off completely. Germany, most of the other European countries have shut the border. Why it wasn't done here and why it wasn't done several weeks ago is really, it amazes me. I mean, good public health and this kind of spreading disease, you have to stop people moving around. I think the attitude here, I'm really kind of surprised. Canada has shut the border.
We hear that the positivity rate has gone down and we're less than 500 new cases yesterday for the first time. Does that mean we might be opening things up here soon if this positivity rate keeps dropping?
Yeah. It's under 5,000, by the way. 5,000, not 500.
Oh, sorry, I misspoke, yeah.
Yeah, okay. Things are going better. Things are turning around and going in the right direction. This is not the time to stop our mitigation efforts right now for a couple reasons. One is the holidays are coming up. People are going to be mixing again. I think, you know, we got through Thanksgiving. Let's get through Christmas and then reevaluate it in January. And then with this new strain coming over, I think, you know, that could be here already. We don't know yet. We really need to be prepared, and we should not be happy with 5,000 or just under 5,000 new cases and have the positivity rate 7.8% or whatever it was. You know, we were talking before, oh yeah, it's got to stay under 5%, you know, and under 1,000 cases per day. Let's remember that, and that's our goal now. We're going in the right direction, so let's get there.
All right, let's get to some questions here, starting with this. People want to know how they will be notified that they are eligible for the vaccine. Will they get a letter, email, call from a doctor, or will a guy be twirling a sign in front of the hospital?
Probably the latter part, the guy twirling a sign in front of the hospital. No, so Illinois, you know, it's all being kind of, the vaccines are being distributed centrally by the government, with the help of the government. And what they've done in Illinois, because Chicago is so big, so it's Chicago and then everything else, all the rest of Illinois. So it's two different regions. So if you live in Evanston, you're in Illinois. If you live in Chicago, you live in Chicago. And so it's going to come from the public health people there. They can actually even set their own priorities, but I think Mayor Lightfoot and Governor Pritzker are going to work together on this. And when the vaccine is ready for those next groups, the public health people are going to make huge public service announcements because they want everybody vaccinated. Everybody wants those people vaccinated. So, you are going to hear from the public health people and then where they're going to do it. They're setting up the places now. Hospitals, pharmacies are going to be doing it, health clinics and the like. But remember, with these vaccines, they've got that allergic reaction component to them. It has to be in a place where an allergic reaction can be handled, because I think the reaction rate now is about 1 in 45,000 people. I mean, that's not very high, but it used to be 1 in a million. So, it's 22 times a higher chance of having an anaphylactic reaction with these vaccines. We don't know about Moderna yet, but it's kind of made the same way, so we suspect that could be true. We'll see. That's what's going to happen.
All right, we'll get to one more question. I'm wondering where we stand with treatments. Should someone be diagnosed with COVID, can you please talk about newer effective treatments?
Well, there's nothing really new, which is kind of a little bit surprising. All the focus has been on the vaccines. We have remdesivir. We have the monoclonal antibodies. We've got this drug, baricitinib, which is an anti-inflammatory that's given with remdesivir. And we have steroids. There's really nothing new than those. And the monoclonal antibodies are being underutilized. They have to be given intravenously, and it has to be before you end up in the hospital. It's got to be right at the beginning of your infection. So if you're in one of those risk groups and you get diagnosed, you should really try to check it out and get a hold of those drugs.
All right, Dr.
made by
Murphy,
2 different companies.
Thanks for being with us. If you have a question for the
Okay.
doctor, you can post it on our Morning News Facebook page. We'll talk to him again tomorrow. Have a good day.
Great. Have a great day.
Hey, Paul.
Hi, guys.